Hello and welcome to Med4Care. Today's topic is intensive care beds, a focus on technology. Let's find out what it is. The difference between an intensive care bed to other beds in hospital wards is a large amount of technology it has inside. These technological electrical mechanisms allow to position the patient in many different ways. By simply resorting to the pressure of some specific commands, without having to move the patient himself. Avoiding subjecting him to the risks consequent to his movement on the bed. There are some clinical conditions that require frequent position changes. For example, a patient who has lung secretions that must be systematically removed can benefit greatly from frequent change of position. In this case, the patient has to be tilted sideways to the right or left, alternately. With the simple press of a command, it is thus possible to tilt the patient to the right or left, so that the secretions move by gravity and do not remain inside the lung to create problems and are more easily removed. Risk of manual position changes. You can move the patient manually, taking the patient physically and moving him right or left, perhaps with the support of cushions, etc. However, these steps are very complex and dangerous, because patients are often not free to move. They have a large amount of cannulas entering or leaving the body, for various purposes. Moving them would put all of these cannulas at serious risk of moving. And the positioning of the same is a potentially very dangerous medical act. Being able to mechanically put a patient to the side using the mechanisms of the bed with the mattress and all, is very useful, comfortable for the staff, and more effective. The sitting position of the bed is also essential, for example for patients who need to breathe independently after being ventilated for a long time, and for whom this position is useful for reducing respiratory fatigue, especially for patients with heart problems. The legs up position is important for the patient in a hospital and even more so in intensive care. It consists in placing the patient with the legs raised above the trunk. For an emergency, such as cardiac arrest, cardiac massage must be performed. This operation must be carried on a rigid surface. If the bed is in a different position, it must be immediately returned to a neutral position. This is the purpose of the CPR key, which immediately returns all parts of the bed to the standard position in a very short time. Most electric beds must be connected to the power outlet to function. So can a battery that allows you to perform movements without connecting it to electricity be useful? Yes, because intensive care beds do not always remain in intensive care. It happens that some patients have to undergo investigations, for example CT scans, magnetic resonances, hemodynamic procedures, etc., which cannot be performed in intensive care, but in other dedicated areas of the hospital. In this case, the patient must be moved from the ICU to his own bed. It may be necessary during the transfer, or in the elevator, to carry out maneuvers. Then change the position of the bed with the electric battery controls. When the patient moves, it is as if the entire intensive care unit moves to assist him. In general, an anesthetist, a nurse and an assistant move with him. He is connected to a monitor. He is connected to a portable fan. There are drugs, injection pumps and everything you need, available for any situation. The mattress is also an important component of the ICU bed. There are standard ones and anti-decubitus ones for patients who are already supposed to remain hospitalized for a long time, to prevent bed sores from developing. A modern bed with a great deal of technology and mechanisms can cost between $10,000 and $20,000. Much also depends on the size and weight of the bed itself. The more contained they are, the higher the costs, because it means that the mechanisms are smaller and less heavy to obtain the same results. We are now at the end of today's video. We hope you enjoyed it. If you found it useful, please support us with a nice like, and subscribe to the channel. See you soon on Med4Care.